right. Know that there'll be a series of videos on Unit 8 so I can cover all the content because feedback I got last semester is you'd rather watch several videos and have all the content covered than to have me skip content because you guys freak out because it might be on the exam. Okay, and I have this frog and I'll try not to clear my throat a lot in the mic. Unit outcomes, go through them, be sure to apply them, know these terms because you will see them, hint, hint, hint. Know these cultural terms, boom, 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 right here because I won't be going over them. Sorry. This is the percentage, the diversity of our workforce. This is the United States. This is Wisconsin. All right, and what you really want is you want your workforce to represent the community in which you work. So we have some work to do there. There are some care delivery models that are set here. Go through them, understand them. Don't spend a crap ton of time on them, but at least be able to identify them and some advantages and disadvantages. The functional nurse method is just that each nurse has a function, right? So yes, the nurses perform all the assessments, but the charge nurse coordinates all the care. So you might have a wound care nurse, a med nurse, that kind of thing, an IV nurse, that kind of stuff. And the disadvantages of that was lack of communication. They did it between providers. Patients get confused. Some needs aren't addressed. Oops, there. Team nursing involves a more staff mix. Primary care nurses and nurses responsible 24 hours a day. Now that doesn't mean that they're there 24 hours a day. It just means that they're the primary nurse for that patient throughout the hospital stay. I think Children's does this. This primary nurse hybrid, the partnership model, this is what we used when I first started. I worked with one tech. I liked it because then I knew who I was working with all the time, and we would go room to room and work together. Case management, the important thing to remember is they do not generate money, but they protect the money that the hospital has. And then their clinical pathways. And you'll see them at hospitals based on diagnosis. If a person comes in with the diagnosis of pneumonia, they should be out in 3 days. Sometimes people have there's a variance is a change to what is expected. It's just something has variance. It can be you can have a positive variance or a negative variance. So a positive variance would be someone came in with pneumonia and the clinical pathway says it should take them 4 days to get out of the hospital with pneumonia, and they got out in 3 or 2. A negative variance would be they're supposed to get out in 4 days and they had to stay for 6. Okay, so it does decrease the length of stay. You have some evidence-based practice deciding how long a trajectory is just a path that something should follow. And you coordinate your care between disciplines. Everyone talks to one another and it's cost effective. Here's just an example. Disease management is wellness care and it's also chronic care. So you'll see this with CHF. We talked earlier about no readmissions within 30 days. So now what they're doing is they're trying to take better care of patients in the community with CHF or cancer or whatever chronic disease you want, asthma, diabetes, trying to keep people out of the hospital and living their best life. Okay, so there's the ADN nurse, that's your tech school nurse. There's the BSN nurse, that's what you guys are going to be at the end of December, and the advanced practice nurse. There's the nurse practitioner, the CNS, all of these roles require more training than what you're getting currently. So you don't have to understand each of these roles. You just need to understand that these roles require more education than the BSN. And then you're an expert in your field. The synergy model, I know, is used at Children's, and all you need to know is that it exists, and basically what they do is they take the characteristics of the nurse and try to match them up with the characteristics of the patient. And what I've heard about Children's is they kind of do it by what children need with certain disease processes, and they match RNs up that way. Magnet. All right, there's a couple slides here on Magnet. Just remember that Magnet focuses on quality. So if you're applying at a Magnet organization, they have a strong commitment to quality. And here's some other components, but I would focus and remember that Magnet organizations focus on quality. Transforming care at the bedside is a nurse place redesign. And basically, if you want to learn more about what happened and what that was about, Robert Wood Johnson Foundation, they funded that. They do a lot of funding for research, and it's what drove CUSIN. Okay, know the difference between staffing and scheduling. Staffing is, the definition is right here. We're going back. This is the definition for staffing. All right, planning for hiring and deploying qualified human resources, meaning people, to meet the needs of a group of patients. All right. So staffing is for now, and scheduling is for the future. Okay, so when you are, you have all these qualified human resources, then you schedule them to work in different areas that they're qualified to do so. All right. Retention. Know the difference between retention and recruitment? Retention is you already work there. Recruitment are activities they do to get you in the door. So the good thing about retention, you want to have nurses who have been there a while, because one of the things that keeps them there is that you have adequate staffing for acuity. So that's a big thing about retention. You have to be careful that the nurses you're trying to retain don't get upset at all the enticements you're getting to get people through the door. Yeah, no idea why this slide is in there. Just know, yeah, just read it, move on. Okay, remember we talked about that nurses impact patient care, and these are the ways that nurses impact patient care, and that came about from the National Database of Nursing Quality Indicators. Okay, and this is in your book, and you can kind of look at that. But these are the things that we directly impact, that we know affects patient outcomes. All right. So if we feel like we're understaffed, then we have less job satisfaction. And the only state that has a law that mandates nurse to patient ratios is California. All right. So to develop your staffing plan, you have to monitor the staff you have and make sure it meets the plan. Make sure you serve on committees that are going to input the staffing plan, and it built on your judgment. If you know who's coming in, or you know who can help you out, it does help you judge where you're going to put people. All right, so these are the needs for 24-hour staffing. And we all know that this is the peak time, and then we have all of this other time, off-peak time. The Joint Commission doesn't have, they'll look at your staffing plan, but they don't have set guidelines on what they should be. Just know that. So what do we look like? So if we have an increased number of nurses um, with a good educational level and a good amount of experience, we improve patient outcomes because there's a decrease in adverse events sensitive to our nursing care. A few slides ago, we talked about the nurse sensitive indicator. So all of these things come into play. And we saw that with the Julie towel example. So we know that it's not that more errors occur if you're working more than a 12-hour shift. If you're working rotating shifts, I did this. Don't recommend it, but I did. This is where one day you work PMs and the next day you might come in for days and then you're off a day and then you come in at nights. Mandatory versus voluntary overtime. Open versus closed unit. An open unit is a med-surg unit. Maybe they'll float to a cardiac unit. Closed units are probably your OB units. They staff themselves. So no one who doesn't have that area of expertise comes in to work on your unit. ICUs might be a closed unit, and agency staff. So as your cost of your staff goes down, your poor patient outcomes rise because nursing care directly impacts positive patient outcomes. So some organizational factors that affect your staffing and scheduling: the structure of the organization and the philosophy of the nursing service unit. Know that each area has its own culture, the policies and procedures. Okay, and who are your support systems? Like sometimes on nights and PMs you don't have transport, or you don't have, like the CNA has to accompany somebody to CT, that kind of thing. You certainly might not have anybody who can come in and give you a tray, right? Because the kitchen might be closed. And then the idea of open versus closed units, which we already talked about. All right, I'm going to stop here so I don't get interrupted during the middle of this, and we will start. And units of service.